Dear friends, let us discuss about the axillary artery. There are four major arteries in the upper limb. They are the axillary, brachial, radial and ulnar arteries, which you can see in this picture. Coming to the axillary artery, it begins at the outer border of first rib as continuation of third part of subclavian artery. In this picture, you can see the subclavian artery. This is the first rib and this is the outer border of it, where the subclavian artery becomes the axillary artery. The axillary artery terminates at the lower border of the teres major muscle, where it continues as brachial artery. In this picture, you are seeing the pectoralis minor muscle, and this pectoralis minor muscle divides the axillary artery into three parts. The axillary artery enters the axilla through its apex and it runs through the axilla under cover of the pectoralis minor muscle, and it is accompanied by the axillary vein throughout its course, and it is also related to the brachial plexus of nervus. So this green one is the axillary sheath, which encloses the axillary artery, axillary vein and the cords and nerves of the brachial plexus. So the axillary sheath, it's the continuation of the prevertebral layer of deep fascia of neck, and it encloses the axillary artery, axillary vein and cords of brachial plexus when the prevertebral layer is continuing into the axilla. So it will be wrapping these structures. The shape of the axillary artery will be different depending on the position of the arm. If the arm is adducted, it is convex upwards and laterally. If the arm is abducted, the artery is straight. You can have a quick glimpse of the arteries of the upper limb. The subclavian artery on the right side originates from the brachiocephalic trunk, whereas on the left side it is arising directly from the arch of aorta, and it is having three parts. At the outer border of first rib, the third part of subclavian artery continues as the axillary artery, which is having three parts, and at the lower border of teres major muscle, the axillary artery continues as brachial artery. Distal to the elbow joint, the brachial artery divides into radial and ulnar arteries that run along the lateral and medial margins of the forearm, and reaching the hand, the radial artery contributes for the deep palmar arch, whereas the ulnar artery contributes for the superficial palmar arch. In this picture, you can see the axillary artery and accompanied by the branches of the brachial plexus and its continuation as the brachial artery, and at the elbow you are seeing the division of the brachial artery into radial and ulnar arteries. The axillary artery is divided into three parts by the pectoralis minor muscle. The first part, the second part and third part. First part is proximal to pectoralis minor and it extends from the outer border of first rib to upper margin of pectoralis minor. The second part lies behind the pectoralis minor. The third part is distal to the pectoralis minor and extends from the lower margin of pectoralis minor to lower margin of teres major muscle, both lower margins. So, lower margin of pectoralis minor to lower margin of teres major. So, now you know the extent of the axillary artery and its division into three parts. In this picture, you can see the dissection. This is the axillary artery and this is the lateral side where it is related above to the, because it is part of the second part of axillary artery. You are seeing the lateral cord relations, and lower down this is the third part which is related to the branches of the lateral cord laterally. That is the musculocutaneous nerve. Then you are seeing the lateral root of median nerve, and medially it is related to the medial cord for the second part and the branches of the medial cord. That is, you are seeing the ulnar nerve and then the medial cutaneous nerve of forearm, and medial to this is the axillary vein. These are some of the details about the axillary artery dissection you have seen in this slide. Regarding the relations of the axillary artery. So, axillary artery is related to the axillary vein. So, throughout its course, the vein is its medial relation. The cords of brachial plexus, the relationship of which varies in different parts. Coming to the first part of axillary artery, both the lateral and posterior cord, they are lateral to it. The medial cord is posterior to it, and there is a loop of communication between the two pectoral nerves. In front you are seeing. Then coming to the second part, the lateral cord is lateral, posterior cord is posterior, the medial cord is medial. Coming to the third part, the branches of the third lateral cord are lateral to it, and you can see the musculocutaneous nerve, and then the branches from the medial cord are medial to it. You can see the medial cutaneous nerve of the forearm, and then the ulnar nerve will be between the axillary artery and vein, whereas the medial cutaneous nerve of arm will be medial to the axillary vein. Now let us see the relations of the first part, second part and third part of axillary artery. Here you are seeing the first, second and third parts of the axillary artery images, and you are seeing a table showing the anterior, posterior, medial and lateral relations of each part of the axillary artery. And you have to read the table and the picture together for a better understanding. Coming to the first part of the axillary artery, it is related anteriorly to the clavicular head of pectoralis major muscle and the communication between the lateral and medial pectoral nerves. Posteriorly, it is related to the medial cord of brachial plexus and long thoracic nerve and the serratus anterior muscle. That is the first digitation of the serratus anterior muscle. Medial relation is the axillary vein. Laterally, it is related to the lateral and posterior cords of brachial plexus. Coming to the second part of axillary artery, it is related anteriorly to the pectoralis major and minor muscles, and posteriorly is the posterior cord of brachial plexus and the subscapularis muscle. Medially, it is related to the medial cord of brachial plexus and axillary vein. Laterally, it is related to the lateral cord of brachial plexus. Coming to the third part of axillary artery, anteriorly it is related to the medial root of median nerve, and posteriorly it is related to the two nerves from the posterior cord, that is the axillary nerve and radial nerve. It is also related to the two muscles, it is the subscapularis above and the teres major muscle below. Medially it is related to the axillary vein. It is related to the medial cutaneous nerve of forearm and the ulnar nerve, which are located between the axillary artery and vein. And medial to the axillary vein is the medial cutaneous nerve of arm. And laterally it is related to the musculocutaneous nerve. So these are the relations of the axillary artery. Now let us see the branches of the axillary artery. So the first part gives one branch, the second part gives two branches, the third part gives three branches. So it is easy to remember. First part, one branch, second part, two branches, third part, three branches. The artery arising from the first part is the superior thoracic artery. The artery arising from the second part is the thoracoacromial and lateral thoracic arteries. The arteries coming from the third part are the subscapular, anterior circumflex humeral and posterior circumflex humeral arteries. In this picture, you can see the branches above the pectoralis minor. So the first part giving the superior thoracic, and from the second part, so along the upper margin of the pectoralis minor will be the thoracoacromial artery. In relation with the lower margin of the pectoralis minor is the lateral thoracic artery, and from the third part they are the subscapular and the two circumflex humeral arteries. So this is the mnemonic for remembering the branches. Save the lions and protect species. Coming to the superior thoracic artery. It's also known as the highest thoracic artery. This is a small branch from the first part of axillary artery, and it originates near the subclavius, and it runs between the pectoral muscles, the major and minor, and supplies them. Coming to the branches from the second part of axillary artery, that is the thoracoacromial and lateral thoracic arteries. Let us see the thoracoacromial artery, so which takes origin at the level of upper border of the pectoralis minor, and it pierces the clavipectoral fascia, and it gives four branches that radiate at right angles to one another. They supply the regions of the upper limb and trunk according to their names. So according to the named branches, they will be supplying those regions. So what are those branches? They are the clavicular branch, which will be going towards the sternoclavicular joint and subclavius muscle. The pectoral branch, which will go and supply the pectoral muscles and also mammary gland. The acromial branch, which will be going towards the acromion process and contributes for the acromial anastomosis. The deltoid or humeral branch, it will go towards the deltopectoral groove along with the cephalic vein and it supplies the pectoralis major and deltoid muscles. The branches of the thoracoacromial artery can be remembered with a mnemonic: cadavers or dead people. Coming to the lateral thoracic artery, which arises from the second part of axillary artery and runs along the inferior margin of pectoralis minor, and it supplies the pectoral muscles and serratus anterior. It also supplies the mammary gland in females. Coming to the third part of the axillary artery. So, the three arteries are the subscapular and the two circumflex arteries. The subscapular artery is the largest branch of axillary artery, and it ends near the inferior angle of the scapula, and it gives a large branch and a small branch. So the larger branch is the circumflex scapular, which passes through the upper triangular space, and it also winds round the lateral border of scapula, and it enters the infraspinous fossa, and it takes part in scapular anastomosis. So the circumflex scapular is the largest branch of subscapular that passes through upper triangular space, winds round the lateral border of scapula, and contributes for the scapular anastomosis in the infraspinous fossa. Then the smallest branch is called the thoracodorsal or the latissimus dorsi branch. You can see that in this picture, the subscapular artery. And coming to the circumflex humeral arteries. These arise from the third part of axillary artery. They are anterior and posterior circumflex humeral. Of the two, anterior is smaller and traverses in front of surgical neck of humerus and at the intertubercular sulcus. It will give a ascending branch to the glenohumeral joint. The other one is the posterior circumflex humeral, which is larger, runs along with the axillary nerve through the quadrangular space, and it winds round the surgical neck of humerus. It anastomoses with the anterior circumflex humeral artery, and it supplies the deltoid and shoulder joint. Now let us see the surface marking of the axillary artery. So for marking it, the arm has to be abducted at right angles to the trunk, and it should be rotated so that the palm faces upward as shown in the picture. This makes the artery straight, and in this position mark a point on the middle of clavicle, mark another point on the lateral wall of axilla by feeling the pulsations of axillary artery behind the prominence of biceps and coracobrachialis muscle, or take a point at the junction of anterior 2/3 and posterior 1/3 of lateral wall of axilla. If these two points are joined by a broad line, that gives the surface marking of axillary artery. Coming to the clinical importance, the collateral circulation. Whenever there is obstruction to the first part of axillary artery, collateral circulation will be established by arterial anastomosis around scapula, or anastomosis on the chest wall, or anastomosis in axillary pad of fat. In the case of arterial anastomosis around the scapula, the anastomosis between the first part of subclavian and third part of axillary artery provide the collateral circulation. So the scapula will be showing anastomosis in relation with subscapular fossa, the supraspinous fossa, the infraspinous fossa, and around the acromion process. In the case of anastomosis on the chest wall, which you are seeing in this image, there are posterior intercostal arteries from the thoracic aorta, the anterior intercostal arteries from the internal thoracic branch of subclavian artery, the superior intercostal artery from the costo-cervical trunk of subclavian, and the highest thoracic or superior thoracic branch of first part of axillary. So they anastomose. This is the anastomosis on the chest wall. Then anastomosis in axillary pad of fat, that will be between the branches of third part of subclavian artery and alar thoracic branch of second part of axillary artery, which sometimes may be present. Then in the case of blockage of axillary artery, collateral circulation will be effective if the obstruction is gradual. So the thrombosis of axillary artery is more common in the baseball pitchers who play the major league. To stop the bleeding from the axillary artery, pressure has to be applied over the artery near its lower end, just above the lower border of posterior axillary fold. The other way to stop the bleeding is compression of the artery against the humerus. The other importance of this axillary artery is the anastomotic network around the surgical neck of humerus will be damaged in cases of fractured surgical neck of humerus. And in this picture, we are seeing the axillary artery angiogram or arteriogram, where you can see part of subclavian artery also you are seeing. Then the thoracoacromial branch, the superior thoracic artery, you are seeing the lateral thoracic from the second part. Then the subscapular artery and the circumflex humeral from the third part. Coming to the axillary artery aneurysm, it is dilatation of axillary artery twice its original size. It is a rare but serious condition because it can cause vascular compromise of the upper limb. The dilated portion of axillary artery can compress the brachial plexus, resulting in neurological symptoms of paresthesia and muscle weakness. In this picture, you can see the dilated axillary artery and see the adjacent nerves on which it can show its compression effects. The treatment is surgical method by excising the aneurysm and reconstructing the vessel wall using a vascular graft. Hope you have understood about the origin, extent, the divisions into three parts, their relations and branches of axillary artery and its applied importance.